Thank you very much. We would like to present the gene polymorphism of beta-3 adrenoceptor effect on the lower urinary tract function in men. We have no COI. The slide shows the association between beta-3 adrenoceptor tryptophan 64 arginine SNPs and OAB in women. Our institutions demonstrate that in the female cohort, there were significantly more patients with 64 arginine variant type in those with overactive bladder than in the healthy controls. However, beta-3 adrenoceptor was also existed in the prostate and prostatic urethra. Although the role of the beta-3 adrenoceptor in those was prostatic smooth muscle relaxation and urethral muscle relaxation, the relation between beta-3 adrenoceptor tryptophan 64 arginine SNPs and LATs and lower urinary tract function was yet to be clarified in men. Objectives. Therefore, to clarify the role of beta-3 adrenoceptor SNPs in the lower urinary tract, it is necessary to investigate lower urinary tract function, especially in men. The present study was conducted to investigate the genotype-phenotype relationship between beta-3 adrenoceptor gene SNPs and both male LATs and lower urinary tract function. SNP genotyping. Blood sampling was done in the pre-operative period. Measurement of SNPs of the gene encoding the beta-3 adrenoceptor were performed using a step 1 PCR system. The present cohort was divided into wild type and variant type. LATs and lower urinary tract function were compared between the wild type and variant type. Examination items. Primary outcome measure was whether the SNP of the gene encoding the beta-3 adrenoceptor are associated with LATs and lower urinary tract function. Secondary outcome measure is whether SNPs of the gene encoding the beta-3 adrenoceptor are associated with lower urinary tract function in the patient with no history of treatment for LATs. Examination 1. Patient characteristics. There were 247 patients in the wild type and there were 129 patients in the variant type. There were no significant differences between the two groups. Association between LATs and gene polymorphism of beta-3 adrenoceptor. In the wild type, 62 patients in BPH and 4 patients in OAB. On the other hand, 28 patients with BPH in the variant type and 2 patients with OAB in the variant type. Therefore, there was no significant association between the beta-3 adrenoceptor gene SNPs and LATs. Association between urology parameters and gene polymorphism of beta-3 adrenoceptor. Maximum flow rate, average flow rate, voided volume, voided time. Significant difference of these parameters were not observed between the two groups. Next, comparison of the parameters of post-voided residual urine volume and 1-hour pad test. Only post-voided residual urine volume was significantly increased in the variant type. Secondary outcome measures. Patient's characteristics excluding patients who had a history of treatment for LATs. There were no significant differences between the two groups. Comparison of the parameters of urology in the patient without having the treatment history of LATs. Maximum flow rate and voided volume were not significantly different between the two groups. However, voided time has significantly increased in the variant type, and average flow rate has significantly decreased in the variant type. Comparison of the parameters of post-voided residual urine volume and 1-hour pad depth in the patient without having the treatment history of rats. There were no significant differences between the two groups. Association between the SNPs of beta-3 adrenoceptor and lower urinary tract function in rats. Regarding lower urinary tract function, increase of residual urine volume and elongation of voided time in variant type. These might be involved in insufficient relaxation of prostate and urethral muscle. Thus, hyperfunction of the beta-3 adrenoceptor in the prostate and urethra might lead to blood outlet obstruction in the variant type. However, regarding rats, beta-3 adrenoceptor gene SNPs were not significantly associated with rats in men. Thus, men have the 64 arginine variant of beta-3 adrenoceptor gene might not have a critical effect on their urinary quality of life. Thank you very much.